so people can find it later. Um, for those of you that don't know me, I'm Cheryl Arno, and I'm the Executive Director of the Down Syndrome Association of Atlanta. And my partner in crime is Howie Rosenberg, and Gigi's is also part of this tonight. You want to say hello, Howie? It's a
All
test.
right. Hi. Welcome, everybody. Glad everyone is here.
So we're so glad that everybody's here. And um, I don't want to hold y'all up because I want everybody to start listening to what these ladies have to say. Anyway, the other thing is that they said that you can ask questions all along versus waiting till the end. So between Abby and I, we will be looking for the chat. So if y'all have a question, if you don't mind, just putting it in the chat box, and we'll take care of you. Anyway, enjoy
Awesome.
enjoy. Take care.
And I just want to make sure, did my screen share work? Everyone can see my presentation? Yeah. Okay. All right, perfect.
So proud.
What's that?
Said I'm so proud that I figured out how to make a co-host.
we learn something new every day. Well, thank you, Cheryl. So as Cheryl said, so I'm Abby Johnson, and my partner Amber Johnson. We are not related, but so we're both dietitians with Harmony Nutrition. So we're a local nutrition practice in Alpharetta. And yeah, to make matters confusing, we have an Amber Johnson and Abby Johnson. We have two Abbys and two Ambers. So when you come to our practice, is very, very overwhelming to know who you're talking to. But I'm really excited to talk about this particular topic, food for thought. So optimal nutrition for growing minds and children with Down syndrome. And to give you a little bit of background, hold on, my slide's not changing. Hold on. Yes, it is. Okay. So to give you a little bit of background about how I became interested in the topic. So I've been a dietitian now for 10 years. And actually my first experience as a dietitian was actually working with kids with special needs. I worked at Children's Healthcare of Atlanta for 3 years. Fast forward about 7 years later, I now have a daughter named Sophie, and she is 2.5, and she has Down syndrome. So I have learned a lot, both first clinically, and then learned a lot about just being a mom to a child with Down syndrome. And so nutrition has always been something that I'm very passionate about, and I've become even more passionate about it, since having kids. But I strongly believe that, well, not believe, but know that there is a huge connection between our brain and our gut. And there's so much that we can do from a nutrition standpoint to improve cognition, to prevent certain types of cognitive decline. And that's something I've, become more passionate about, since having Sophie. Amber, who works with me. So Amber, I'll let you talk about yourself too, Amber, but I'll brag about you for a minute. So Amber, when she came to our practice, so her background was already in working with children with special needs, particularly with sensory issues, and talks a lot about food aversions, different types of feeding disorders. And so when I came up with the idea of putting this presentation together, felt like Amber and I were kind of like the perfect combo. I'm more of like the sciencey, like nerdy kind of approach. And is someone?
Ladies talking about dietary things.
I think someone may not have it on mute.
Oh, you're on mute?
But anyway, so that's about me and Amber. But I'll go ahead and get started. So why does nutrition matter? Why discuss this topic? So a few things that some of you may already know, some of you this may be newer information, but I'll start with the facts, and I'll just go ahead and tell you, like, the first 2 slides. I'm going to talk a little bit about risk factors and just things that we need to be a little bit more concerned about in children and adults with Down syndrome. But the positive piece of this, and this is why I'm so excited about it, is that everything that I'm about to talk about and discuss are things that can be helped, possibly prevented, and managed through nutrition. So We'll talk about why nutrition matters first, and then we'll kind of talk about how we want to approach it. So we know that people with Down syndrome may have slower metabolisms and are more likely to develop hypothyroidism compared to their neurotypical peers. Adults with Down syndrome are at higher risk for developing cardiovascular disease, which can also be prevented and managed through a heart-healthy diet, which we'll talk a little bit more about. And adults with Down syndrome are also more likely than their neurotypical peers to develop Alzheimer's disease, which is going to be the primary focus of this particular lecture. Is how do we prevent that, and how can we improve cognition with nutrition? So we know that about, as it stands today, so about 50% or more of people with Down syndrome will develop Alzheimer's or dementia by their 50s or 60s. That's based on today's data. So my hope and my goal with all of this is that we can change that number. Down syndrome, we know, is caused by an extra copy of the chromosome 21, which includes the amyloid precursor for the protein, the APP gene, which is known to be a genetic link to younger onset of dementia. However, there's also a lot of research that's coming out about how do we kind of manipulate this gene through nutrition and help to prevent, again, like earlier onset of dementia. We know that the prevalence of dementia worldwide is estimated to be around 45 million people and is predicted to actually triple by 2050 as a consequence of a few different things: increased life expectancy, establishing dementia as one of the biggest global health challenges. So that's worldwide. That doesn't just apply to Down syndrome, but we're noticing a larger prevalence of it now. So what do we know about the modifiable risk factors for Alzheimer's? So modifiable risk factors include having diabetes, avoiding smoking. So hopefully we're all doing that anyway, but smoking puts you at a higher risk for Alzheimer's. People that struggle with depression earlier on in life are also more likely to develop Alzheimer's. Mental inactivity and physical inactivity, which are two of the reasons that I'm so passionate about what programs like Gigi's Playhouse does for our community, because there are so many programs up there, including like the FIT program, the cooking class that Amber and I lead. And it's all about just really like just trying to keep our kids engaged in the community and keep them mentally in tune. So just like with neurotypical people, we know that mental inactivity, or just kind of not having a purpose, not having activities, not having things to do, can lead to a quicker decline in cognition, not just in Down syndrome, but in everybody. So keeping involved in all of these things that are available to our community is really important. We know that hypertension puts us at a higher risk for Alzheimer's, obesity, as well as lower educational attainment, which again, we know that today, if for all of the parents out there of kids with Down syndrome, we know that there's so many more educational opportunities available to our kids today than there were 20 years ago, which is why, something that I'm incredibly excited about. But I want to switch the focus a little bit and talk. Most people have at least heard of or read something about the Mediterranean diet. So the Mediterranean diet, there's been more studies on the Mediterranean diet for everything from Alzheimer's, dementia, ADHD, depression, anxiety. There's been more studies on mental health in general in correlation with the Mediterranean diet than any other diet. And this, I really like this visual because it really shows, and we'll talk a little bit more about what the Mediterranean diet looks like. But when you look at this visual, so this is a PET scan of brain activity. Now, this is of a 50-year-old woman. This is a 50-year-old neurotypical woman. And when you compare the two brains, so you'll see like this brain here. So this is this is a woman who followed more closely the Mediterranean diet. And this is also, this is a different woman who followed more of a Western diet for the majority of her life. And you can see the difference in the colors. So if you look on this side, so the color scale reflects brain activity, with brighter colors indicating more activity and darker colors indicating less. So the scan on the right looks greener and overall darker, which means that the woman's brain has substantially lower brain activity than the one on the left. And you can see where these arrows are pointing. So these red arrows here. So the arrows point to the reduced metabolic activity in the brain regions that are typically affected and associated with Alzheimer's. So when you look at this, you can see visually, like, what does the Mediterranean diet do to the brain? And that goes back to that gut-brain axis. There's a direct connection between our stomach or our gut and our brain. So let's dig in a little bit more to more of a Mediterranean style diet, and how do we introduce that early on to our kids? So I like to focus on these 5 categories. So I like to call them like our brain power foods. So talk about blueberries and berries in general, cold water fish, nuts and seeds, greens, and then what I like to call gut foods, or our prebiotic fermented foods like kefir and yogurt. All right, so let's start with fish. So when we look at like what the Mediterranean diet, like what does that Mediterranean diet pyramid look like? The Mediterranean diet typically includes more cold water fish, a little bit more the cold water fish, followed by poultry, and then a lot less of like our red meats and processed meats. Not to say that we should completely keep those out of our diet, but there's so many benefits to be had from cold water fish, particularly because of a few really important nutrients that they have. So the dietary benefits of fish include, we know that we get iron and zinc from fish, and that supports children's immune systems. And that becomes important with Down syndrome, particularly because we know that sometimes our kids are at a little bit higher risk of catching some of these viruses and colds and things that especially go around in the wintertime. So keeping a strong immune system becomes particularly important. Fish are also a source of other nutrients like protein, vitamin B12, vitamin D, iodine, and selenium as well. And the recommendation is to try to include 2 servings of fish from our best choices list. And I'm going to share that list with you in just a minute. So what does a serving look like? So when we look at what a serving looks like, a serving is about 1 ounce for ages 1 to 3, 2 ounces for ages 4 to 7, 3 ounces for ages 8 to 10, and then 4 ounces for ages 11 and up. So when we say try to eat 2 servings, you would base that on the age of your child. I will say from experience, and this has nothing to do with Down syndrome, this is just me being a mom of 3. If you introduce fish a little bit earlier on, I have found that my kids are more likely to enjoy it versus, sometimes when you try to introduce fish later on, it's kind of like, I really like the chicken nuggets because let's face it, chicken nuggets taste really good. But, not to say that chicken nuggets are bad, but fish is also a really important source of protein. When we look at one of the most important nutrients that we can get from fish, that would include omega-3s. So omega-3 fatty acids are a particular type of fatty acid that has really highly anti-inflammatory properties. So we know that like the basis of Alzheimer's is rooted in a form of inflammation. So if we can try to reduce neuroinflammation over a lifetime, that has the potential to help reduce the risk or at least delay onset of things like dementia and Alzheimer's. So when we look at like how much omega-3s should our kids be getting, the recommendation, you can refer to this chart here. So 0 to 12 months, 0.5 gram, 1 to 3.7 grams, 4 to 8 years old, basically 0.9 grams, 9 to 13, 1.2 for boys or 1 for girls, and then for 14 to 18 and up, 1.6 grams per day for boys and 1.1 grams for girls. So what is that, like, where do we get those things from? So you can look over here at the source chart just to kind of give you an idea of what kinds of foods could we derive some of those omega-3s from. And these are just some examples. There's a lot of foods that contain omega-3s. These are the ones that are the highest. So salmon, cod liver oil, which I'll get into in just a minute because I have some cool things that I've done with cod liver oil. But salmon, cod liver oil, herring, sardines, ground flaxseed, flax oil, or chia seeds. These are all really potent sources of omega-3s. And by the way, as Cheryl mentioned in the beginning, if you come up with comments, questions, anything that comes to your mind as I'm talking, please feel free to put something in the chat. All right. All right. So best what? Okay. Sorry, my daughter came downstairs. All right, so best choices for my child. So this goes into like some of the best choices for fish. There's obviously some other good choices out there too. These tend to be, especially the ones in green, are going to be the ones that are higher in omega-3 fatty acids. But all of the ones listed here are a little bit lower in mercury as well, which often becomes a concern with fish consumption. So these are really great choices for kids. My favorite are the cod and the salmon. I think that the cod has like a nice white flaky taste to it. So especially for kids that are like, I don't like that like fishy taste. Cod can be a good choice. All right, so let's switch gears for a minute and talk about berries. So berries have really potent antioxidants, and particularly the ones that have blue and purple pigments to them. So things like blueberries and blackberries contain a really potent phytonutrient called anthocyanidins. And the cool thing about anthocyanidins, so they're very potent antioxidants, and the anthocyanidins can reduce or inhibit those amyloid beta plaques or amyloid beta species, which are one of the hallmarks of Alzheimer's disease. So essentially what they do is they inhibit the buildup of that amyloid plaque. And so the recommendation, and so in studies, what we've seen is that people that have higher intakes of deep colored berries like blueberries and blackberries have a lower risk of dementia and Alzheimer's. So we can take that research and kind of translate it into what can we do for our kids starting from a young age. So aiming for 1 to 2 servings or approximately like a half a cup to a cup of fresh or frozen berries per day can be very beneficial. And you can introduce it to your kids in really cool ways. It doesn't have to just be a plain old blueberry. You can throw it in a smoothie. You can make popsicles. We actually did this recipe at Gigi's, I think like maybe a few months ago. So it's 2 ingredients. So you take either your Greek yogurt or dark chocolate, roll it in the blueberries, and then throw it in the freezer. And it's a nice little like candy treat. So there's so many different ways that you can introduce berries early on. Greens. So as part of the Mediterranean diet, greens and berries, fruits and vegetables are at the base of that pyramid. So trying to include as much produce as you possibly can. But we know that people who eat leafy greens, fruits, whole grains, olive oil, beans, nuts, and fish have fewer proteins in their brains that are linked to Alzheimer's disease than people who don't eat as much as those types of foods. And you could see that in that first visual that we showed on the PowerPoint. I really try to encourage my parents to focus as much as you can on your dark leafy greens. All vegetables are great. Let me kind of start off by saying that. So cauliflower, Brussels sprouts, broccoli, green beans, cucumbers, those are all great vegetables, but your deep leafy greens are really, really rich in those powerful antioxidants that we know help to kind of manage or divert neuroinflammation. So things like spinach, kale, collard greens, mustard greens, chard, things like that. It can be raw, it can be cooked, obviously depending on the age of your child and what's appropriate. But again, and my trick for introducing everything, you'll see a theme, is throw it in a smoothie. So if your kid's not into spinach, hide it in a smoothie, put some cocoa powder in there, make some chocolate spinach, and it's a lot more acceptable. But anything, you can try anything in a smoothie. I typically recommend, and this is not just for kids with Down syndrome, but just for kids in general, when you're able to, introducing greens before fruit can be helpful, just because we know all kids like fruit. Fruit tastes good, it's sweet. So if you can kind of get them a little bit interested in things like, cooked spinach, green beans, things like that before the berries, it's helpful. If you don't, it's not the end of the world. However you introduce food and however you get your kid to eat, the foods that work for them is really the most important thing. We know that as kids get older, kids have preferences just like adults do. So, we've had kids in our office that, they don't like broccoli, but if you put cheese on the broccoli, they'll eat it. I'm cool with that. Amber's cool with that too. So if we have to dip the broccoli in ranch dressing, if we have to put cheese on it, we've gotten some more obscure ones. Like I had a kid that only liked vegetables if it had barbecue sauce on it. I'm like, that's cool too, because we still, we still got there's no wrong way to eat vegetables. So however your kid likes vegetables, that's the way to go. We don't say no to that. Switching gears for a minute. So I'll always keep referencing that huge connection between the gut and the brain. Spoiler alert, my specialty is both kids and GI, so I talk a lot about the gut, and I've become more and more passionate about the gut pretty much being responsible for everything that happens in our body. But we know that there's neuroprotective effects that come from fermented foods. So new research suggests that fermented foods offer neuroprotective effects that could be useful to treat and even prevent the progression of cognitive decline seen in dementia and Alzheimer's. So improving the quality of our gut bacteria. So we know that everybody has bacteria in their gut. Everybody has bad bacteria in their gut and good bacteria in their gut, and that's normal. But uh-oh. Is someone asking a oh. I think someone may have their microphone. Okay. Improving the quality of gut bacteria helps to increase the what's called the bioavailability, or basically like the ability for certain nutrients to kind of work in our body in foods, and decreases gut permeability. So what gut permeability means in very, very simple terms is some people have maybe heard of the term leaky gut, but having really strong cellular structure or tissue structure in the gut helps the gut to do its job by keeping things inside the gut that need to stay inside, and then keeping things out of it that shouldn't be there. And over time, that just helps to reduce systemic inflammation and neuroinflammation. But to kind of back up for a minute, so the fermented foods that I'm referring to, so things like kefir, yogurt, sauerkraut, kimchi, kombucha, all of those foods are considered fermented foods, and that's what really increases that healthy bacteria in our gut. Things to think about, so making like a parfait with fruit. I said I was going to circle back to the cod liver oil. So if we circle back to cod liver oil, so just a half a teaspoon of cod liver oil gives you all of the omega-3s that you need up to age 8. So one of the things that I used to do with my daughter, and I still do this sometimes, so cod liver oil, they have cod liver oil for kids that has flavors. So there's like an orange flavored cod liver oil, there's lemon, there's berry. And I know most people probably think like, ugh, the idea of putting cod liver oil in yogurt sounds awful. When I tell you my kids love it, it tastes like, it's like putting orange flavoring in a yogurt. So you can make the yogurt really fun by just adding a little bit, like just a half a teaspoon of the flavored cod liver oil. And then I personally, like I said, I personally did this for my daughter. So I would mix the ground flaxseed, the cod liver oil, and the yogurt. And that was her breakfast almost every morning. And she loved it. So you got 3 of your power foods in one breakfast or in one meal. So you got your fermented foods, you got your omega-3s, you got your flaxseed, which is also a good source of fiber. So it's a great, just a great little way to introduce some fermented foods.
Hey, Abby, you talked the other day about the different kinds of sourdough and how like, different types are going to be more contributive of that good bacteria. Could you speak to that?
Yeah, so sourdough is also a great example of a fermented food. So sourdough bread, That's part of the baking process is fermented. However, what I learned when I was going through my training on fermented foods is that not all sourdough is created equal. So, if you really want to get those like beneficial, like, fermentation, like, health effects from sourdough, getting it from a bakery or making it yourself if you're into making bread, you're getting like a true sourdough. I learned that if you're getting the sourdough off of just like the main, like the shelf where most of the bread is sold, just like the pre-made bread, it's oftentimes not a true sourdough. So it has sourdough starter in it, but it has a lot of other things in it too. And I think also because of the time between when it was baked and when it was actually shipped and made, you don't get quite those same effects. Doesn't make that bread bad. It just means we don't get all the goodies that come along with like a true sourdough. I've had patients that I'm very impressed with that always make their own bread, and they make their own sourdough bread. I am not that person. I don't know how to make bread, but I respect people that do. I'm not that talented. But yeah, sourdough is a great source of fermentation. All right. So other ideas. So I've kind of touched on a lot of these things, but we talked about like the frozen blueberries. You can make it fun, make it like a little like frozen candy. This picture down here, these are actually salmon balls. So instead of meatballs, you just use the salmon and kind of still use the same idea, like breadcrumbs, seasoning. That can be a fun way to get your kids interested in salmon. So if they're not really into like, it's a piece of fish, make it into a meatball. It makes it a little bit more fun. This up here is actually chia seed pudding. So in this, all you do is basically take your chia seeds. For those of you that haven't used chia seeds before, they expand when you put them in liquid. So if you take the chia seeds and soak them in either yogurt or milk for 20 minutes or more, they expand and kind of make more of like I guess I'd compare it to like a tapioca pudding kind of consistency. But it's a great way to get some good fiber, as well as omega-3s. This down here, we've actually made a bunch of these in our Gigi's cooking club, of different variations, but this is basically taking some sort of nut butter. So we talked about like incorporating more of your like healthy fats, so like nuts and seeds as part of the Mediterranean diet. So taking like an almond butter, you can do oats, you can add ground flaxseed in there. You can put chocolate chips in there and make it fun. We did one with like apples and cinnamon one time. It was really good, but and everybody loved it. So those are good ways to introduce
Yeah,
some of them.
here it's kind of gotten muted.
I got muted. Uh-oh. Nobody else can hear? Can everyone else not hear me or no?
I'm able to hear you.
Okay.
And
Huh.
I can hear you too.
Okay. I'm not sure.
okay, we had a comment that you are heard.
I can hear you.
Okay.
Okay.
Okay. That let me know if it goes out or if you can't hear me. I'll make sure I do something different. But so these are so we've done a lot of different variations of these in our cooking class. So you can use, like I said, flaxseed, some sort of nut butter. There's really, what I've learned is there's no wrong way to make these. Amber, you did it with the black. This is what you did with the black beans, right?
Yeah, we had black beans, dates, some protein powder,
Mm-hmm.
and some sun butter in it. And they were delicious.
Yeah. Yeah. Those are always winners. I find that like even with my really picky kids, like because we got some picky kids and some picky teenagers, if they don't eat anything else, they'll do these. They're like not into like the vegetable portion of it, but they'll eat some flaxseed balls. So I love it. This is flax oil. This kind of like the cod liver oil, you can really mix into anything, but it's a really way to just easily add some omega-3s to things like yogurt, oatmeal, a smoothie. The flaxseed oil particularly doesn't have any taste to it. The cod liver oil, like I said, you can get in different flavors. So if you're wanting to mix it into more of like an oatmeal or a yogurt, sometimes that's nice to have a good flavor to it.
Oh, we had a question on yeah, Jacqueline asked, she read that almonds can also block absorption of certain vitamins. Is that true?
So there's a lot of, let's see, how can I say this? there's a lot of information out there that suggests different foods block absorption of certain nutrients, and I think we kind of have to quantify that. So I think what you might be referring to, or what you may have read, so there are certain components in things like almonds, different types of seeds, beans. There, you'll read some things that say like different types of legumes block absorptions of certain nutrients. And to an extent, there is a little bit of truth to that, because there are certain nutrients that compete with other nutrients. There's naturally formed compounds called oxalates, for example, that you find in certain foods that block the absorption of like calcium, for example. But I think sometimes we take that information and blow it up to mean something that it doesn't. So sometimes what we read, yes, it blocks a little bit of absorption of certain nutrients. But does that mean that if you eat almonds, it blocks absorption of all nutrients? And the answer is no, because we have to look at that conversely and look at, okay, well, what are all of the other nutrients that almonds offer? So we know that almonds offer, they have a little bit of calcium. So they have a little bit of protein, of healthy fats, small amounts of selenium. And so you kind of have to look at, okay, does this food add nutrition to my diet? And if it blocks a little bit of the absorption of certain other nutrients, as long as I'm getting a well-rounded diet and I'm getting those nutrients every single day, your body's going to absorb what it needs in most cases. So I hope that answers your question, but that is likely where that came from.
I will tack on, if you like almonds, eat the almonds.
Yeah. There you go. Were there other, oh, I missed a whole bunch of questions. I'm sorry. I was just talking.
It was more on the volume thing. That was the more substance question.
Oh, okay. Okay. All right. So everyone can hear me. Okay. All right. Perfect. Well, I will turn it over to Amber. And then at the end, if you've been saving up your questions for the end, we'll still be here. Hold on. Okay, there we go. I was trying to get it to change. Okay.
Awesome. Well, thank you, Abby. I think you provided a lot of great information. So while Abby was talking more of the hardcore science and the numbers and the research, this phase of our conversation is going to be a little more on the softer side. So talking about kids' behavioral patterns, what we can do as parents, and how to support our kids in supporting the healthiest relationship with food that they can. All right, so slide, please.
Oh, sorry.
All right. So what we know is about half of folks with Down syndrome often experience interoception and sensory issues. So what that means in English is that they have a more difficult time recognizing hunger and fullness cues and certain body sensations that they are experiencing. What we also find with some of our sensory eaters is that a lot of them are super tasters. All right, so in referring back to Abby's conversation around blueberries, while, you know, most neurotypical people, we can eat a blueberry and be fine. And if there's a little sour one in the bunch, we can recognize it and keep going. To a child, or even with an adult who's more of a super taster, this is a huge, wild difference. And for them, that just lands a little bit differently, and it can lead to feeding aversions, where they don't want to take that risk of having something taste a little bit different every time. We're just going to remove it from foods that we're going to accept. So having neurodiversity does have a strong influence on our eating patterns. All right. Again, with the quieter interoceptive and awareness cues, but our job as parents and caregivers is supporting those healthful eating patterns and teaching our kids, getting them an appropriate care if needed, so that they can become the most competent eaters possible. All right, so we can go ahead and switch. All right, so I'm sure many of you are familiar with MyPlate. If you are not, this is the newest iteration of the food pyramid that we probably all grew up with. And this essentially encompasses the balanced variety of foods that we would like humans to consume. All right, and they all have a very important purpose, a very important job when it comes to nourishing our kids. So echoing off what Abby said earlier, our fruits and vegetables, chock full of vitamins, minerals, antioxidants, to help support a healthy immune system. They're also rich in fiber and rich in fluid. So if our kids are experiencing constipation, that can really help things. All right. Proteins, they make up our muscles, our skin, our hair, and nails. They are important components in the development of neurotransmitters and hormones in the body. So they are key in making the whole work of being a human happen. All right. Our grains and starchy vegetables, just as well, they have a lot of B vitamins, magnesium. Our whole grains have a lot of fiber in them. What grains get called out for a lot is all the carbohydrate. And I'm here to tell you that our muscles and our brains' favorite form of fuel is carbohydrate. So if you've taken away that carbs are bad, that is not true. Particularly if we're working with like a pickier child or a child with sensory issues, grains can be a very vital way to keep our kids nourished. All right, so we're not going to demonize any food group out there because they all have a very important job to do. All right. Last but not least, we're thinking about our dairy products and calcium-rich foods. All right. So thinking about strong bones, healthy bones, and certainly the minerals that they bring, the calcium and the magnesium help counteract some of any sodium intake that might be happening to help lower blood pressure and lead to better cardiovascular health. All right. So taking everything together, we need a little bit of everything from every food group presented here to be able to support our best health. And where the hiccup can come in is if we're having kids, whether for picky reasons or for sensory reasons, just aren't engaging, what kind of tools can we use to help encourage a more balanced eating pattern? All right, so we can switch. Thank you. So as we go through the rest of the presentation, we're going to be talking essentially about two buckets of kids. We have our picky eaters and we have our problem feeders. And when I say problem feeder, this is more of the term used in the literature. These kids are not problems. They have a very valid eating issue, whether it is based in medical trauma, sensory issues, an oral motor skill deficit. They aren't trying to be hard. All right, they're doing the best they can. So I want to put a little asterisk by that problem feeder because I'm not a huge fan of the term. But for our little ones, as we're kind of trying to sort out where they land in these buckets, when we think about our picky kids, all right, generally speaking, they will accept at least 30 foods, all right? So we're thinking about 5 or 6 foods within each of those food groups, all right? So they may be picky about certain things, but they still have somewhat of a nice variety, all right? They're experiencing food jags, all right? And I think anyone who is wrestling a toddler right now knows what I'm talking about, where peanut butter and jelly sandwiches might be the only food that they want day after day after day after day, until the day where they look at you like you're insane when you offer them a peanut butter and jelly sandwich. All right. So they're very on of food and they're very off of food. The difference between the picky child and the problem feeding child is that peanut butter and jelly sandwiches will come back into the rotation. All right. So all the different foods that they're rejecting will eventually come back. All right. When these kids are presented with new foods, there might be, a little bit of pushback. There might be a rotten little face, but they're going to be able to tolerate it. They're going to be able to keep it on their plate. They might even taste it. They might even like it. All right. It's not a huge thing going on. All right. Picky kids are also okay experiencing different textures across different food groups. All right. So if they eat mashed potatoes, they're probably going to be okay with a baked potato. They're certainly going to be okay with French fries. All right. They're eating a little bit of something from each food group. They haven't completely eliminated vegetables or completely eliminated proteins. All right. Conversely, when we have our kids with more sensory or oral motor issues, when I see kids who lean more into the ARFID category, so an avoidant restrictive food intake disorder, all right, where there's something physiologic happening. Again, picky kids, it's more of a behavior thing. ARFID, problem feeding kind of kids, it's something a little deeper than that. All right. They will generally accept less than 20 foods. All right. In my history working with kids who have trouble eating, their diets might exclusively be beige. chicken nuggets, French fries, goldfish. And if we try a different brand of chicken nugget, no, that is not a chicken nugget. That is something entirely different. All right. And again, pulling into that super tasting, they're really able to discern differences between different brands of food and different types of food. All right. They also experience food jags. The exception here is that those foods tend to be dropped permanently. And so they don't make it back into the rotation. So as time goes on, if we're eating 20 foods, that gets whittled down and down and down until they're only eating a handful of foods generally. All right. One of the biggest things that stands out to me is the refusal to interact with something new. All right. In more severe instances, these kids will gag, they might throw up, they're in hysterics, they push food away, they don't want it in their space. It's essentially, you know, as if one of us was served a piece of roadkill. Like there is not an argument in the world that would make us engage with that. All right. And that's how these kids perceive it. Like it is offensive, it is disgusting, and they can't. They're not going to be able to do it. All right. Oftentimes with these kids, they're refusing large categories of foods. My child doesn't eat green vegetables. My child doesn't eat white food. My child can't eat proteins. All right. Whether it's from a traumatic event around a certain food, or whether, you know, sometimes it's more of a texture issue. You know, when we think about meats, that's hard. It's hard to chew. And if they don't have those oral motor skills, you know, there's the risk of choking. They're associating it with something very unpleasant. And so it's easier just to push that off. All right. Well, we've also noticed in these kids where the sensory issues they aren't just alive with food. We're thinking about kids who are sensitive to smell, sensitive to noise. They might not like having like messy hands or a messy face. They might have trouble, you know, they might experience discomfort walking on grass or walking on sand. For some kids, it shows up in toileting issues, either from the quieter interoceptive awareness, where they're not able to recognize when they need to go to the toilet. Alternatively, there are some sensory issues that show up where it's very uncomfortable. Like just the idea of having to go to the bathroom is just overwhelming. And so they hold, and then constipation will happen or accidents will happen. All right. So as we move forward, I want to make sure that we're not bringing these groups together so much, because there are two distinct groups with two distinct issues, and we're going to go about it in somewhat different ways depending on what's going on. All right. So we can change slides. So our approach that we start with it's from a dietitian and family therapist named Ellen Satter, who came up with an approach to eating called the division of responsibility. And essentially her mission in this work is to raise competent eaters, all right, where kids will learn to eat what the caregivers are providing. They're going to be able to understand and recognize there's those interoceptive cues of hunger and fullness, and they're going to be able to learn to behave appropriately when they're eating. All right. So a little bit of oversimplification. There are parent jobs, caregiver jobs, and there are kid jobs. And never shall these jobs intersect, right? The parents need to do what they need to do, and the kids get to do what they need to do. All right. And what this does is they're going to grow into these competent eaters who are able to recognize their own cues. They're not going to be eating as a function of mom and dad said I have to, or mom and dad said I can't, or I shouldn't have this because someone else told me what to do. They're going to be able to honor that internal wisdom of what is going to serve them best. Right. And ultimately, these kids are going to grow in a way that is genetically correct and appropriate for them. All right. Which I imagine for all our kids, that is what we want. All right. We want that independence and that ability to determine what is going to be best for them. All right. So we'll start out with the parent jobs. All right. And I will say this as a parent. Oh, Abby, we can change slides.
Oh, yep.
Thank you. And I will say this as a parent who has worked this with my children. Some of this can be heart-wrenching and incredibly uncomfortable, but for the picky kid, we've got to think of the long game, because this is going to serve them really, really well. All right. So parents' jobs, you decide when meals and snacks are going to happen. All right. Generally speaking, Our littler kids need to be eating about every 2 to 3 hours. Older kids can probably go about 3 or 4 hours, all right? But we want planned meals and snacks. Again, broadly speaking, every family is different. We will have breakfast, lunch, afternoon snack, dinner, possibly an after dinner snack. If your kids are early risers, there might be a morning snack in between lunch and dinner, right? But essentially whatever works for the family dynamic, eating about every 2 or 3 hours to every 3 and 4 hours to align with the kids' ages. Little tummies need to eat more frequently. Bigger tummies can go a little bit longer, all right? But you decide where eating is going to happen. Are we going out? Are we going to eat outside? Are we eating at the kitchen table? All right. You decide what is going to be served. Okay. You also decide what behavior is going to be expected from the kids. All right. So to dig in a little bit deeper of this, particularly when we are talking about the meals and snacks and what will be served, we want to be conscientious of what our kids like, but we don't want to cater to it. All right. Oftentimes what I advise parents to do is if we're going to introduce a new food, pair it up with an old favorite. All right. So like Abby, what you had mentioned earlier, if we're going to try a new vegetable, let's pair it up with their favorite cheese, their favorite salad dressing. All right. It makes it a little less scary. It can kind of help blunt the challenge of a new taste if that's going to be something for them, and it can make it be like more easily accepted. All right. So we want to start gently. We don't want to, overturn everything overnight. We want to be conscientious of what our kids are able to do. All right. So certainly, we don't want to hold a 2-year-old at dinner for 45 minutes. They're not able to do that. Generally speaking, we want meals to last about 20 to 30 minutes. Snacks can be anywhere from like 5 to 15 minutes. All right. For kids with little appetites who are easily distracted, sometimes they'll take 4 bites of food and then they're off and running. What I would encourage y'all to do is, set the behavior, set the expectation of everyone is going to sit at the table until mom and dad or whatever your role in the family is, until our tummies are full. All right. Oftentimes for a lot of picky kids, they'll eat just until that hunger has had the edge taken off of it. So they're not really full. They're just not hungry anymore. But if they're allowed to stay at the table, they're more than likely going to pick at it a little bit more. And they're going to be better able to recognize when fullness happens. All right. Now, when it comes to our sensory kids, we want to be mindful of, fish tasting different each time, depending on how it's cooked or the cut of it, and the appearance and that kind of thing. So if you feel like your child might have more of a sensory issue going on, it can be a really nice and easier thing to rely on some of these packaged foods. All right. So I'm not saying like hot dogs every night or anything like that, but exploring frozen fruits and vegetables, exploring canned fruits and vegetables, because more often than not, they're going to taste more similar every time. These kids are going to know what they're getting into. So they're going to have an idea of what something is going to taste like, how it's going to feel in the mouth versus a fresh fruit or vegetable, which can be a little bit tougher. All right. Generally speaking, we want to serve a meal, or well, maybe not more of a meal, from 3 to 4 food groups, and particularly at mealtime, serving small portions. All right. Let the kids get engaged with their food and let them ask for more as they want more. Okay. For our more sensory kids, we want to keep their accepted foods on their plate. And if they're curious about something on someone else's plate, just saying, you know what, this is mom or dad's food, but I'll let you have this. All right. We're throwing in a little bit of reverse psychology to be like, this is something special. So they're going to try a little bit harder to like it and be able to overcome some of those obstacles that they might be experiencing.
Amber,
Right.
am I supposed to be on the kids' jobs? The next slide?
No,
This one?
we're still on parents'
Oh,
jobs.
sorry.
Yeah, you
Okay.
got it. Yeah. In addition, and we'll kind of like wrap it up here for the parents' jobs, is we don't want to praise any kind of eating. We don't want to beg. We don't want to plead. We don't want any non-neutral commentary around food. Okay. Again, because we don't want these kids eating for their parents. We want them eating for themselves. So we can absolutely comment of like, I am really happy that you tried this. would you like some of this food? All right, but we don't want to get emotions into it, because for the picky kid, they will completely take advantage of that. For the sensory kid, it makes it a little bit tougher because they want to be pleasing their parents. They don't want to get in trouble, and that just adds a layer of difficulty to it. All right, so now we can switch over to kids' jobs.
Mhm.
Yeah. All right, so the kids' jobs in all this is to be able to work within those boundaries. All right, so they are going to decide whether or not they want to eat out of what has been served. They are going to decide what to eat from what has been served. And they're going to decide how much to eat from what's been served. All right. So essentially, as parents and caregivers, we're going to give them the boundaries, and we're going to let the kids operate as they need to within that. All right. So commonly I get the question of like, well, how do I get my kid to eat more vegetables? Serve more. You know, if we only have enough protein for everyone to get one serving, we only have enough carbohydrate for everyone to get one serving, but we have an abundance of vegetables, those kids are going to be more likely to try them, because for a neurotypical kid, or for a picky kid rather, being hungry doesn't feel good. So they're going to be more willing to try something new than to end a meal or a snack still feeling hungry. All right. So we want to create that space for them to work in. They're going to mess up, and that's okay, because that is how we learn. All right. The gut-wrenching part of this is letting your child leave the table knowing that they haven't had enough energy to get them through the next few hours. And so they might be cranky. It might feel bad when they come begging for food in between a meal or snack. But it's really important to let them know that we can have water in between our meals and snacks, and you're going to have the chance to eat again when we eat next time. All right. So whether it's for dinner, whether it's breakfast the next day, and what we'll find for our picky kids is they're going to have more incentive to eat and more incentive to try something new, because hunger can be a strong motivator. All right. So, in essence, kids need the freedom and the structure to support their growth, their comfort in eating, and their confidence in trying new foods. All right. We don't want to dictate to them. All right. No clean plate club, no earning dessert. We want them to explore what feels good to them and what is satisfying to them in their own way. All right. And what we need to trust is that for picky kids, they are gonna eat what they need to grow predictably and to get to the body size that is genetically best and healthiest for them. Okay. I know, and I have been there myself, where, you know, we get a little worked up. It's like, oh, my kids didn't have vegetables for 2 days, or they missed breakfast a couple days. It'll be fine. These little kids know their bodies, all right, and they're going to be able to nourish them in a way that is healthy for them. Right. Moving into the next slide, and this is more focused on our sensory kids. If you find, there we go.
No, there we go.
Yeah. If you find, or if you already know, if your child is on the autism spectrum, if your child has comorbid medical conditions in terms of GI issues, reflux, medical PTSD in terms of if they've had a lot of tubes or suctioning or a lot of like unpleasant things happening with their mouth, any issues with choking, right? That can certainly steer a kid away from wanting to try something new, because they're associating fear with pain and discomfort, and they would rather starve. All right, so that lends itself more to a sensory or a feeding disorder. If you present your child with food and they're arching their back, they might be throwing up, pushing the food away, refusing the food. That's not a picky kid. That's something we got to dig in a little bit deeper on. All right. If they've had an eating or a feeding disorder, a history that you know of, the oral trauma that we talked about. In particular, the biggest thing that comes out is when you apply those division of responsibility principles, and these kids go on a hunger strike, right? It's not being stubborn and maybe not eating 2 meals in a row. These kids would rather not eat anything for days on end than try that food. All right. So for whatever reason, it can come from a myriad of places. They associate food as being painful, traumatic, unpleasant. All right. And so what we want to do in those instances, take them to a pediatrician, and let's get referrals to GI to make sure that any kind of medical issue is ruled out. Alternatively, if there is a medical issue or GI issue, it is treated appropriately. particularly for reflux. Eating can be a very, very painful experience, but once we can resolve that, we've got a starting place to go. In a lot of instances, getting a referral to OT, occupational therapy or speech and language therapy for evaluations, so that they can rule in or really rule out any kind of oral motor skills. They can do some sensory work in terms of like a progressive desensitization towards certain foods and certain textures. There's a lot of really great frameworks out there that have been successful with a lot of kids. So while we at Harmony are happy to support all these kids with sensory feeding issues, ARFID, feeding disorders and things like that, it takes a multidisciplinary team to really help the kids best. So depending on the age of your child, leaning into Babies Can't Wait, Marcus Autism Center, like I mentioned, speech or OT, feeding therapy, and having us at Harmony help support in terms of textures of food, different foods that can be provided. We work in a collaboration a lot to make sure that we all have our eyes on the prize of making sure our kids can accept the most and the greatest variety of foods out there to help support their best health. All right.
And I know we ran a few minutes over, but I do want to make sure that we have time for questions too.
Yes. So yes, we love our neurodiverse kids. I think they bring like their own magic to the world. And I think our job as parents and caregivers, clinicians, is to help support them be their best, help them grow into the awesome little people that they are, so that they can take advantage of every opportunity and not have, very minimal barriers to get to where we want them to be. So with that, thank you. I guess, Abby, we're ready for questions.
Yeah. And sorry that we kept you guys up a little bit later.
Everyone's in their pajamas now.
Yeah. Does anyone have any questions? Okay. I think you can Cheryl, can they unmute okay.
Did you answer the one about organic foods?
Oh, no, I didn't see it.
I didn't see that one either.
It was early on. Yeah.
Oh, okay.
I'm always
can-
fascinated by that question.
Was that your question?
It was not mine. It was Cynthia Livingston. Cindy.
Oh, I don't know why I don't see that. I'll
Sorry,
let
I sent it straight to Cheryl. Yeah, I was just wondering about in the concept of early on with vegetables and how much does that matter and what do we need to be cognizant of?
I'll give you my answer on that. So for organic produce, what I usually tell people is two different things, right? So when it comes to organic produce, you think about, like, if you look at the food visually and you see, like, let's take, for example, like a pineapple or an avocado and compare that with a strawberry, right? So the strawberry is going to be more like a sponge. So whatever pesticide or whatever was sprayed on it, most likely there's going to be a little bit of that obviously left in the strawberry, as opposed to like an avocado. Nobody eats the peel of the avocado. Nobody eats the outside of the banana. So if I'm weighing, like, what do I want to spend my money on? If availability and finances allow you to purchase organic produce, particularly the ones that are more like your strawberries, blueberries, spinach, for example, go for it. If financially organic produce is not an option, I will always tell people conventional produce is better than not having produce at all. I never want someone to not eat strawberries because they're concerned about the pesticides. There is small concern about some of the levels of pesticides in some of our produce, but the benefits that we get, the antioxidants, there's still antioxidants in conventional strawberries. There's still nutrients in conventional blueberries. So don't feel bad. Don't feel like you're making a mistake by getting conventional berries, but if you can get organic, go for it. The other thing from a cost saving standpoint is I'll say that, like, most people, I think a lot of people don't realize that, like, frozen produce is actually just as nutrient dense as your fresh produce, and in some cases actually more nutrient dense because it's flash froze at the peak of ripeness. So like from a cost saving standpoint, like I love smoothies, getting a bag of like frozen organic strawberries is going to be significantly cheaper than getting like the fresh, the fresh berries. So that's my answer. There's benefit, but do I think that you need to completely avoid, conventional produce? No. So I hope I answered that. I think Raw Benton had a question.
I didn't. I saw one from Marvin about tips for little ones eating in the schools in a social setting, like at school.
Oh, sorry.
Yeah.
Here, sorry, Amber. I think Ra, you've had your hand up for like a minute. Let me grab Rob Benton's question and then let's go back to that question. Sorry, I'm trying to keep everybody in queue.
Hey there.
Hey.
This is Ra.
Hi.
I'm Chrissy.
Hi, Chrissy.
We have 3 children.
Uh-huh.
Ra's vegetarian,
Mm-hmm.
and we decided that we would raise the kids vegetarian as well.
Mm-hmm.
Until such time they can be fully informed and make their own decisions as far as omnivore, vegetarian, whatever.
Yeah.
And our one of our daughters has Down syndrome, and it's 3. She's on a G tube, and so far our GI, is it GI specialist has prescribed her just Pediasure.
Okay.
That's all she has. And she has a twin brother. He's typical. He eats everything. And we're just wondering, is Pediasure enough? That's my biggest question for her age to improve her cognitive development. Is it enough? Second question would be, I'm not vegetarian. Ra used to be pescatarian. Should we be giving her little samples of fish or cod liver oil or that sort of thing to improve? Like, is vegetarian enough for cognitive improvement, or should we be including the fish for her?
She is allowed to eat small amounts of thicker purees, smoother.
Oh, okay.
Like
okay, perfect. So to answer the question about like, do we need to introduce fish, or is it, is it doing a disservice to not introduce fish, for example? So I'll always say, like, being a vegetarian is a choice, and it definitely comes with benefits. So I think that you can be healthy, completely healthy, being vegetarian or being, being a meat eater. I'm a vegetarian myself, so I completely, get it. One of the things I'll say is, like, you don't have to eat fish, and people that are vegetarian particularly actually utilize the plant-based sources of omega-3 a little bit more efficiently than people that do eat meat. So you can still get really adequate omega-3 fatty acids from things like your flaxseed oil or ground flaxseed, chia seeds, ground pumpkin seeds, hemp hearts. Those are all really good sources of omega-3. So there's no rule that says that you have to have fish or that you have to have cod liver oil. Now, if you want to introduce fish, there's definitely benefit in it, but you can get those nutrients from other sources. So does that make sense?
Yes.
Yeah.
And then to your second question about Pediasure. So, I mean, from a nutrient standpoint, absolutely. I mean, if you look at the label, I mean, taking Pediasure is like having a multivitamin. So you're getting all of your essential, vitamins and minerals. I will say, just as a mom and a dietitian, I think Pediasure is a good product. You do miss out a little bit on some of those like potent antioxidants that you can only get from food. Like you can't replicate like what a blueberry or what a strawberry or spinach gives you in a commercial beverage like Pediasure. But you mentioned that your daughter is also eating purees, so you still have that opportunity it sounds like to give her some of those superfoods as well, even if they're, you know, in small quantities. So yeah.
I
Does
would
that make
also,
sense?
Yes. Thank you.
Uh-huh. Yeah.
I'd also add, if y'all are interested in exploring blenderized tube feeds,
That was on the tip of my tongue.
yeah. So, it takes an expensive blender that often insurance will cover. But just putting in whatever you all are eating, blending it up like into a nice puree that won't get clogged up in the tube. So even like, so she's still eating with the family, eating the same food. And it can
Yep.
help with food acceptance, because even as she like burps or kind of has that feeling, she's gonna have that sense of taste come up. And
Yeah.
so the oral can just be like play and just kind of, you know,
Yep.
playing around with different textures, different flavors, and just having fun with it.
Yeah, that was on the tip of my tongue, Amber. I have quite a few patients. I just think I have 4 patients right now that are on blenderized feeds. So wanted to transition from something like a Pediasure and do something that was more food based. So it's basically what it sounds like. It's like a big giant smoothie, but it's a little bit more scientific than that. But you know, it they can still taste it. I mean, it's incredible to hear from the kids, like they really have preferences on their blenderized feeds, even though they're not eating it. Like you know, they can kind of taste what's in their stomach. But another opportunity just to introduce some of those, like, you know, those superfoods that we talked about. That's an option as well.
We asked her GI about real food blends, like and they kind of waved that off and said, no, Pediasure is just fine. But she'll be 3 in August.
Okay.
Formula kind of.
Yeah, I mean, I'm a fan of True Food blends, and Nourish is the other one. I like all of those, you know. But you're gonna get a slightly different answer from a dietitian, you know, versus a doctor. I mean, the GI doctor is not wrong. Pediasure does give you what you need, but if you're looking for more of like a whole food approach, yeah. Amber, you were reading a question that someone had submitted.
Yes. Any tips for little ones eating in social settings like school? I was gonna say that is the $1 million question. If you've ever gone to eat lunch with your kids at school, it is organized chaos. I don't know how any school-age child eats anything, because everyone's talking to their friends. A lot of times they only have like 20 minutes to actually eat. So depending on what their history has been at school with eating, what I have a lot of my kids do, particularly the ones with ADHD, who just like across the board, not eating lunch because of the medication, front load their day as much as possible. And then when they get home from school, pick back up where you left off. Right. And just using lunch as almost like extra credit. Because again, with that environment, with everything going on, that's not going to be a reliable meal for them to make sure that they're eating everything. Yeah. Okay. The next, Abby, I'm going to throw this one to you. Do you all have a good resource for a list of foods that should be paired together? For example, turmeric and black pepper, or citric acid, vitamin C foods, and spinach.
Oh, it's a good question. We don't have like a ready-made list, but you hit on a you know, one really important one, which is like the spinach and the citric acid foods. So you're referring to iron and vitamin C. So we know that vitamin C aids in the absorption of iron. So particularly for our kids that struggle with iron deficiency anemia, or have problems getting enough iron, pairing those iron sources, whether it be spinach or like a meat-based source of iron, with some sort of citrus fruit or something that contains vitamin C, aids in absorption. Yeah, I don't have like a list. It really depends on like the nutrient that I guess, you know, that you're trying to target. Getting back on the topic of iron, I guess another thing that I've seen, and this is more of an unpairing than a pairing, is if we're getting too much milk, like if we're getting too much dairy, that can inhibit the absorption of iron. So while milk is good for us, we also want to make sure that we're not overdoing it. So making sure that we're getting the proper amount. But yeah, I know that doesn't all the way answer your question, but it really depends on like the nutrient that you're trying to target. So
And I'll add on a larger scale.
yeah.
A lot of time when I talk about food pairings, it's more of the context of a snack.
Mhm.
So making sure when you're snacking, you know, typically there's going to be a carbohydrate of some sort, so a fruit or vegetable or a grain. Making sure to pair it up with like a protein or a healthful fat. It's more satiating. It's a more steady release of glucose into the bloodstream. It's more satisfying rather than having those like sugar spikes and sugar crashes. So it may not be entirely what you're asking, but that's a good pairing when it comes to snacks.
Mhm.
All right.
Did we miss any other ones?
The next question I have, from Cynthia, my child with Down syndrome is not on the growth chart. Does the age recommendations align for her, or is it weight size something we need to review instead? Abby, I believe they have growth charts for kids with Down syndrome.
Yeah, they have growth chart. I think she's referring to like the amounts of
Oh, gotcha.
food. Yeah. But yes, it is important to make sure that we're looking at the Down syndrome growth chart and not the typical one. But do you want to answer that, Amber, or do you want me to?
From my perspective, I think we can use the same portion sizes. Is that the question that you're asking?
Yeah, essentially. Yeah. Just any sort of like thought process around it.
Yeah. What I would recommend is just starting with like an age appropriate portion and then just following your child with that. You know,
I think also to piggyback on that. So in terms of like your baseline recommendations for needed nutrients, like let's take calcium, for example, right? So we know like, so if you need 3 servings of calcium per day in order to meet your need of 1,000 milligrams of calcium per day, that doesn't really change if you're underweight, overweight, nor, typical weight. But what changes is your calorie needs. So yes, we want to use food as a way to get back on the growth chart and gain healthy weight. So, in terms of like, do you need more blueberries than, someone that's, typical weight? No, but adding like your calorie dense ingredients and foods to the food that we're already eating. So things like, we know that like, peanut butter, almond butter, olive oil, those are all very nutrient dense, calorie dense foods. So, you have, 2 children, one who is struggling to gain weight and one who is not. Both have mashed potatoes. The kid that's struggling to gain weight, we add a tablespoon of, olive oil or a more calorie dense ingredient to that particular food. But in terms of like your baseline nutrients, it doesn't change. So does that answer the question?
Yes, beautifully. Thank you so much.
Okay. Yeah, you're welcome.
and certainly, I think that's a great opportunity, Abby, to piggyback off what you shared. Incorporating the olive oils, incorporating avocado, incorporating like extra egg yolks, nuts, nut butter, seeds. They're not just going to be extra energy dense. So even if your little one is only taking a bite, it's going to be the most energy dense bite out there. But it's also going to bring a lot of like the vitamins, the minerals, all those things that are going to help them function best to the table.
Yep. Hi, kitty cat. I'm looking at everyone's screen.
Kitty cat.
Anyone
I
else
think
have
we
any
answered
questions?
everything.
I think so. Yeah, I failed to put any of our information on the slides, but I think it was on the handout. But if there are any questions that you come up with, after the session, you're welcome to reach out to us, or if you're interested in making an appointment, our pediatric team, Amber and I are here. But I guess I didn't put it on the slide, but our website is harmonynutritionatl.com, but you can also email me directly if you have questions. It's Abby, ABBY, at Harmony.
You want to put that in the chat?
Oh yeah, I guess I could do that, huh? Yeah, let's do that. I'll put all of our information
Sounds so modern.
here. Yeah, I didn't even think. I'm just like, I'll just say it. I don't know. All right, yeah, I am typing it now. Okay.
So I can say that I certainly learned a lot tonight, and I can't thank y'all enough for coming on and then even giving us an extra 20 minutes. We are so appreciative. I know everybody learned, and I know I can guarantee you by tomorrow I will have many emails asking to see the taping of this. So what
Yeah.
we're hoping is that this is the first of many conversations, because it is something that's really important to our community. And I think that y'all explain it in a very simple and logical way, and understanding what our kiddos are going through. I had a few parents call and talk about adults too, so hopefully we can address that as well at some point.
Yeah. Yeah.
And so I would love to welcome y'all back. But for tonight, thank you all for coming. We're thrilled, and like I said, I hope that this will be the first of many discussions with Abby and Amber Johnson, not sisters. So, Howie, thank you for bringing this to us to do, and I think that, again, I think it's such an important topic. I hope y'all all got something out of it. I'm actually going on vacation first thing in the morning. So in all likelihood, you will not receive this tape until Monday or Tuesday. But tape, see, that's how old I am.
I
It's
was like, did she
recording.
say tape?
I understood that.
Howie's just rolling his eyes going, oh my God. So, yeah, so we will be sending out the recording. And then certainly you can share it amongst your friends. And then it will also live on our YouTube stuff. So you'll be able to see it again. But again, thank you so much for coming out on this evening. And if there are no more questions or anything, then we will say thank you, and y'all have a great night.
Thank
And a
you
happy
both.
Thank you all
4th to
for joining.
everybody.
Yeah. Thank you, everyone.
So I just also, I do just want to say out loud real quick is that Howie and I, love to put these things on. I mean, DSAA really likes to run some of that educational stuff. It's for more local people. And so if y'all have any other ideas for events or people that you want to hear from, please let us know, and we will see if we can accommodate you. Between Howie and I think we have a lot of resources in this community for you. Again, thank you, and y'all have a great night.
Bye-bye.
Thank you, guys.